Today's really an opportunity for the community to express its concern about what's been happening at the hospital. So first of all, we've got the closure of obstetrics and gynecology, and that's kind of the immediate issue. We've had 4 obstetricians have left, and we're being told it's difficult to recruit specialist staff to Whakatane, but we think that the issues are much deeper than that. And if we look at the hospital, it's just the tip of the iceberg. There's a number of departments that are on the verge of collapse. There's chronic staff shortages, staff that are there are under huge stress and in despair because the care that they want to provide to the community and that they know they can, they're not able to because of the systems just aren't there to support them. So today's really a day for people to express their concern, express their anger, and demand, first of all, the immediate reopening of the obstetrics and gynecology services, and we're saying that they need to put locums in place immediately to fill the space while permanent recruitments are made. But there's wider issues than that. So recruitment, the whole recruitment system is completely dysfunctional. People who are recruited into roles in Whakatane, the contracts have to go to Tauranga and Waikato to get signed off, and that can take months, by which time people have moved on. So one of the things we're saying is we want heads of departments to be able to appoint staff to existing vacancies on their own initiative without having to go through the bureaucracy. And that would actually solve quite a lot of problems. There's no recruitment support, there's no HR support, so there needs to be some specialist recruitment people put in place. One of the things we asked for was a general manager, and us and other people, because the concerns of the coalition, the Hikoi for Health Coalition, are really just reflecting what we're hearing from the community and from medical and health professionals. So there's been demand for a general manager, and that's just been announced that they are going to appoint a general manager. So I think that will really help. And the other thing is we just want to see better support. We've got amazing medical and health staff here in Whakatane. The catchment goes up to Hicks Bay, so these people service right up the coast. Amazing people, and they're just not getting the support they need and the systems behind them that they need. So we want to see that urgently addressed.
I have come up here to Whakatane today because it's really important for us to support this kaupapa. What's happening in Whakatane around obstetrics and women's health is symbolic of what is happening all over the mutu when it comes to small hospitals. It's putting babies' lives at risk, it's putting women's lives at risk, it's creating anxiety, and it's a direct result of the $1.4 billion cuts that this national government has made to the health system. They need to get obstetrics and secondary level obstetrics happening as soon as possible. It's not good enough to say that people can wait for a year. What happens to all those babies and mothers in the meantime? One thing we do know from Dunedin, we mobilised 35,000 people, and finally the government sat up and listened to us, and we got a result that was as good as it probably could be in the circumstances. I just want to encourage the people of Whakatane to keep mobilising. We will support you to keep this top of the agenda in the news media, because we don't want to see anyone die, and we want to support you to make sure you can get the outcomes you need. We want to hold this government to account, and when Labour is back in our next parliamentary term, we will not forget our rural hospitals.
Look, as a mother, I know the anxiety that comes when you are pregnant, and the pending birth and what that means, and the feelings that you go through before that, and how anxious you can be, particularly for first-time mothers. And this situation has compounded that and has made that even worse. And our children are our taonga. Giving birth is the greatest gift ever, and we seem to be in a situation now where that's become more and more challenging. And we understand what that's about. It's a travesty, I think, that in a centralised health system we've ended up with more managers than ever. And they couldn't manage this issue in a timely and efficient way to ensure our mama and pepe were prioritised. In the centralised system, areas like the Eastern Bay of Plenty, Portaki, Galatea, Te Kaha get further away from the decision makers and quickly become the poor cousins down the road. And I think you will all understand that, and you'll all be feeling that as we go through this process. Look, I'm pleased that Health New Zealand has listened to you and has agreed to one of the main demands, which was the general manager for the hospital, as Nandor alluded to. That is a fantastic first step. It doesn't detract from the fact that we should never have got to this situation in the first place, but we are here now, can't change what's happened, we can change what happens next.